So those of you who are joining, just want to officially welcome you to our webinar, Virtual Care Insights, where hospitals stand and how to scale, and not just how to scale, but how to scale. Maybe this should be underlined with impact, actually. And I'm very pleased to have Claire Zangerly co-presenting with me, who has a background that is really tailor-made to have, this conversation. She's worked as a system CNO at Allegheny Health and has been CNO before that of individual hospitals like Cleveland Clinic, and has worked in outpatient, not just dabbled, but like really a good background in home care too, and hospice, I believe, Claire, is that right? And has been recently focusing on what used to be volunteer work with AONL and their workforce task force, and on the board of the American Hospital Association. And then now you're on day 8 of your new job, am I right?
That's right.
So
That's right.
congratulations to you now being the CEO, the new CEO coming in of AONL, which is near and dear to my heart. And with that, your role as the CNO for the American Hospital Association. I don't know if you want to just take a minute and talk about your new role and what your first 8 days have been like.
Yeah, sure. Well, I feel like I'm drinking from a fire hose, but
I can
I also
imagine.
feel like I have a little bit of an advantage having been a board member of the AONL
Yeah.
twice and been
Mhm.
on the board of AHA, and seen the work behind the scenes. It is such a great organization that supports nursing leadership, from the frontline nurse leader, entry level nurse leader, all the way to end of career nurse leader, and all kinds of nurse leaders. So I'm excited to carry on the legacy of Robin Begley, who was there for 6 years, and then before her, Pam Thompson, and
Mhm.
others too, that have really built in almost 50 years of AONL, in the support of nursing leadership as a practice. So I'm very excited about the work that we're doing, relative to diversity, equity, and inclusion, workforce, workplace violence, supporting all nurse leaders across the continuum. So it's just an honor to have this opportunity.
Great. Very excited to see you in Boston.
Yeah.
Um, so what we're going to kind of cover in the next 45 minutes or so, we have completed the second of a longitudinal study on virtual nursing and inpatient virtual care. So we're unveiling the results of the second part of it today and talking about what that means as far as adoption of inpatient virtual care. But before we do that, I want to do a quick audience poll and anonymously being really honest, looking at yourself versus looking at the headlines. Where do you think your organization is on adopting inpatient virtual care? Are you lagging behind a little or a lot, or are you a leader? Um, where are you putting yourself? And I'm going to write this down. Okay. 67. Okay. Nobody considers themselves leading, and most 67% are thinking we're kind of lagging behind. We have some catch up to do. And about a third of you feel like you may be on track with where everyone else is. So let's go over a little bit about these two surveys that we just completed, very large surveys, and what they tell us. And then we might revisit that polling question later and see, after you see the real concrete data from these pretty large studies, to see if maybe you're reconsider where you're at. So keep it in mind, I'm going to ask again, and you're able to change your answer after you hear from the research that we've done. So the first one that we did was 18 months ago, and it was very focused on virtual nursing. And we had over 700 respondents, and both of these studies have been done by a third party, which is Jocelyn Insight, very reputable. Claire, I don't know if you worked with them.
Oh,
With,
yes. Yes. We, AONL, I believe, works with them, not exclusively, but on
yeah.
our longitudinal studies as well. And, we have such a large membership of 12,000 people. Being able to work with Jocelyn to work with companies like AvaSure to be able to expose members to taking surveys like this. So some of you on this call probably participated in this survey and the survey in 2024. So I think that's great because it's just an opportunity to look at those. And this won't be the last time we ask you to participate in a survey. So Jocelyn is always tries to make it easy for us.
And I first heard about them through the Daisy. But I believe they did some pro bono work for Daisy, and I gotta love that. And American Nurses Foundation and the Studer Group. So these both of these have a 95% confidence level with just a 5% variance. So pretty rigorous research. And this first one was focused on virtual nursing specifically. So you look at the roles, they are very nursing focused. And the number one reason back in early 2023 was improving nurse satisfaction and retention. And the number one, virtual nursing use case was discharges, which makes sense to me for especially for patient flow. And that's a very complex virtual task that nurses can do, and we see that as an early use case very commonly, but it's changing and evolving as you'll see. So the second survey that we did is not entirely, in the next slide, not entirely apples to apples. We broadened it to just inpatient virtual care. And we again worked with Jocelyn Insight as well as Chime. So we could you can see broader roles participating in it. And so not just nursing, not just leaders, but we also had a good percentage of staff, bedside nurses in this second one. And about 35%, you'll see we kind of pull out some of the results on specifically kind of executive hospital leadership roles. So that'll make sense as we go into some of the other results that we have. So let's get into it. So this one is, we did ask the same question 18 months ago, and again, to slightly different audience. I'll say what jumps out to me first is that leaders believe that virtual nursing will become or is becoming an integral to care delivery models in acute care. And it was a strong 66% 18 months ago, and now 74%, with fewer maybes on that. But then when you group in beyond leaders, just kind of the whole group, the answers look a little different. What jumps out at you from that, Claire?
Well, I do think I think that the data from the two separate surveys demonstrates, on in April of 23, going from 33% of the hospital leaders being a maybe to 24%. That seems very interesting to me, and I don't know if it's because, um, they're they're looking at a lot of people look at virtual nursing as a solve for the nursing shortage, and we know that is one element of the solve because it's going to reduce nursing workload and attract more people and retain more people, but it's not the only answer. So maybe the hospital leaders have a different view of it. What also stands out to me is that there is a little bit of a gap between hospital leaders and all respondents, because hospital leaders are saying a yes at 74% in 2024, but all respondents are at 57% for a yes. And that demonstrates the gap, I think, between people who are working on the front line, doing, the direct care, perhaps, that aren't as exposed to virtual nursing solutions that the leaders are exposed to. And we've talked about this a lot, but you can't open your email and see somebody had from some publication hasn't said virtual nursing is going to solve the nursing shortage. Virtual nursing is going to help, you know, cure the ills of access to care. And you know, most of the nurses on the front line aren't reading about it. So we have it incumbent upon us as nurse leaders, I think, to get to our front line, talk to our front line about the options. So number one, they're not scared of it. Number two, they
Mm-hmm.
know it exists. And number three, that they can be part of the solution.
100%. And I had the privilege last week to speak to 500 unionized nurses in New York that are part of the SEIU 1199. And the organizers of that event really wanted those nurses to be able to ask the questions they might be afraid to ask, or nobody was afraid to ask questions in that audience, honestly, but about virtual nursing and AI. And I was a little nervous going into that because I was worried about the fears that
Mhm.
that bedside nurses might have, and there were 500 of them there. But it was just a phenomenal. It just filled my heart to spend the day with those frontline nurses, and they were not, I don't think, adverse to virtual nursing and AI. Just after presentations and some of the most heartfelt questions for them were fears that it would be punitive to have
Yeah.
AI or a camera, watching their work, that for some reason that would lead to disciplinary actions for themselves. So, and I think the take home from the audience and the panel and the leaders that organized it was the frontline nurses need to be at the table even before um, decisions about purchasing, just like way up front, um, on the journey of virtual care. And to that end, on January 9th, we're doing our next webinar with Karen Cox, who's the president of Chamberlain University. And that, I think, they graduate more nurses than any other academic organization in the United States. So Karen and Cole Edmondson from Nurses on Boards, and Karen Henson, a leader from Community Health System, CHS, we're going to talk about how do we get this education more upstream in undergrad, so that nurses in nursing school are exposed to virtual care, AI, technology, what nursing is going to be like in the future, before they even graduate. So I'm really excited about that, and I think that's part of the answers.
Well,
Undergrad
and
education and upfront
yeah,
employment.
for sure. And we've seen recently even some of the collective bargaining agreements have inserted language in their collective bargaining agreements that decisions cannot be made around virtual nursing, specifically AI, without their
So
input.
yeah,
And that's not a bad thing.
I don't
Um,
think
you know, I mean, everybody has different views on collective bargaining agreements, and I've lived them for many years. But I do think we're seeing more engagement between nurse leaders and IT leaders. Like, don't just go out and write a check for something without talking to us first, because we are the end users to implement this. And that's where, you know, we would encourage people to have those conversations with IT. It doesn't have to even be at the highest level of IT, just somebody that who is in different discussions and those types of things. Talk to your CEOs. None of these decisions can be made without nursing input at the point.
And that actually, I think we're going to pull some of that data up later about the perception of IT that we were able to pull into the second survey. Spoiler alert, it was very heartening, actually. I
Mhm.
think we're on a good track with that. Okay, on this next one, we asked people on the next slide, in the 2024 study, to just kind of rate themselves in their organization. Where are we right now? Kind of like a little more in depth of what our poll that we started off. So, Claire, when you first saw this, what were some of your initial reactions?
Well, I guess the no virtual care at 29% being the highest was a little disheartening,
Yeah,
because you think, I mean, maybe they are doing some type of virtual care and they're not recognizing it. That's
maybe.
that's the
Yeah.
first thing that I hope. Or there's no appetite for virtual care, or they don't believe in it. Um, but I did like to see that, people are diving into virtual sitting. That was my first foray into virtual care, and it sort of whet the appetite to say, oh, this is a whole nother world that we can participate in. But it's also heartening that there's partial implementation. That's a pretty high number too.
Um, and then only 10% feel like they're, really there and have been really standardized. So there is when you look at this, there's a little disconnect from the like 74% feel like this is a part of an integral part of patient care. So why have only 10% or even, a few percentage points? Do you have any thoughts about what the disconnect is?
I think the disconnect is just lack of education about what's available and what's possible.
Yeah.
Um, and I think that really is what it is. And that's where it's incumbent upon us as nurse leaders to say, these are the things that are out there, and ask people, what is it that we're trying to solve. And I think a lot of times when we think about technology and those types of things, people get stuck on our EMR is a dinosaur, it's tough. They don't think about, okay, EMR is one thing, but then there's these other things, the way that we deliver care, we can actually tap into some of these really progressive technologies that can help us be more efficient, and allow for less just noise around the work that we do, and allow us to be nurses again.
Yeah, that's the dream. And I heard a really great story actually at this virtual nursing panel I was on at the New York Nurses Union. The CNIO from Bon's course told a story. He was a nurse manager of an oncology unit early in his career.
Hmm.
And when he said, we always talk about, nurses need to work at the top of license and but he said he learned a really important lesson there was a lot of the patients there had breast cancer and so nurses typically very commonly did manicures on that oncology unit
Hmm.
and he learned how important that was and how much that was nursing that was
Hmm.
taking place. How that helped this the self-esteem and the self-image of patients. And then while they took the time to do manicure, they were talking about
Educating.
their fears, like just opening up, and then it really truly was a top of license interaction. So
Hmm.
when you say virtual care allows, nurses to really practice. I love that idea that you can take off some of the workload burden to free nurses up to paint fingernails.
Hmm.
Not when we say top of license, I feel like that can sound almost exhausting. Like I'm only going to be critically thinking, like,
Right.
not a minute to pause and do something, more low tech and hands on, like
And
nail
human.
than
Yeah.
human.
Right.
Exactly. So that's the goal is to get to free up nurses with technology so they can be more human and have those moments. So a little bunny trail there, but on this next slide, we really kind of want to address this problem of I see where I want to go. We're not there. How do we get from there to here? And this is our inpatient virtual care maturity model. And it's kind of a framework and blueprint for how to take those steps in a very thoughtful and disciplined way. And so we actually had some of our nursing and IT leaders within that survey rate themselves. And again, nobody's really feels like they're at nirvana where they ultimately want to be. And many feel like they're very mired in very traditional care delivery. And so, Claire, you were a part of in designing as in our advisory board, kind of
Hmm.
it, um, designing this blueprint and this framework, which it gets more detailed as well. So what's
Mhm.
your kind of first reaction to these results and advice for how do I move from either 1 to 2 or 2 to 3 or 3 to 4, wherever I'm at?
Yeah, first of all, I love the structure of this because it kind of gives you a grade of where you think you are, and it's more of a self-assessment,
Yeah.
and it's aspirational too because you look at this and you say, okay, this is where I am now, and how do I want to be more innovative? And I need to go through the stages. I need to have the discipline of going through the stages because I can't go from 1 to 5. I have to go through 2, 3, and 4 to get to 5.
Mm-hmm.
So I think that's important for people to realize. And if you're at 1, it doesn't mean you're any lesser than somebody at 5. That's just where you are.
Mm-hmm.
And again, it's subjective, and it gives you sort of a framework to say, okay, these might be some milestones that I have to hit in this particular stage of the maturity model before I can move to the next stage. And some of those are specific to the organization, but
Yeah.
this gives a really, really good framework. Now, um, again, the 29% having no virtual care workflows. Hopefully, that number will go down as time goes on, and people start to realize there are options and solutions out there for them. Even if they're small solutions, they're still in that early exploration stage. So moving from early exploration to strategic advancement, in my opinion, is probably the hardest place to go, because once you get into strategic advancement, then you have the data to measure, and then you become mature. But getting from traditional to exploring isn't as hard as it is than getting
Yeah.
from 2 to 3.
Yeah, and I think what you mentioned it earlier, and it's a key part, is starting with the problem to
Hmm.
solve. So it's not a shiny object. Oh, we want to do that, or I read something in
Yeah.
Becker's. I'll pick on Becker's because
Yep.
I it's clickbait for me when I get Becker's. I'm like, oh,
Yes. Yep.
But
Yep.
yeah, I think there can be a publication bias for people don't tend to publish on what does not work. So what's there is what has gone well, or even part of the implementation, the only aspect that went well. And so I think really making sure that you're having the discipline to start with what are the actual problems that we have that we need
Hmm.
to solve. We have 80 people in the holding in ED right now, or on the night shifts, 75% of our nurses are novices, or, just what's the organization challenge. And then I think what you were alluding to, and I think maybe this is especially important from 2 to 3, is sort of that change management, governance, sustainment. You want to talk about that at all? Like how do we have that sort of that governance in place?
Yeah, I think addressing governance is very important, but I'm gonna back up a little bit of what you said about what we don't see is what people try and don't do and don't go forward with. I
Yeah.
think that is where we're lacking some transparency. And
Yeah.
I think that would be so valuable to the field,
Mm-hmm. Mm-hmm.
where tell us where you've failed fast and where you've scaled fast,
Mm-hmm.
because that would give people sort of motivation and hope to say, okay, I'm not wrong. I tried this, it didn't work. Now I have to reapproach. And that there's nothing wrong with that. But relative to, the strategic advancement, that's the introduction. That there's so many, we have initiative fatigue in most of our hospitals and health systems
Mm-hmm.
because we kind of have the let's try this, let's try that, and we don't always see it through to the end. And then we have a lot of unclosed loops, unclosed
Oh,
circles.
yes.
And so that I think is it's not sustainable. And especially in we're trying new models of care through virtual care, that we have to engage with the front line. We have to engage with the people who are doing the work to say, is this sustainable? Is this something you can implement? And that change management is so important. And you don't even have to call it change management to scare people and all of, and because people usually think change management, that's like a class. It's what is that? Change management is just talking about, putting processes in place, using your frontline committees, engagement committees to do this work, finding people who are champions for the work that are actually there to do it. You don't need to hire a change manager. Your change management folks are there doing the work every single day. And that, I think, is a tactic to maybe engage in so that you have adoption of these
Yeah.
different solutions.
Yeah. And then the governance piece is making, like you alluded to earlier, making sure that IT is working very collaboratively with the clinical side and other important stakeholders. I saw some great, I went to the American Telemedicine Association Virtual Nursing Summit in Dallas, and there was a little bit of transparency and honesty in the room there, which was awesome. People were scribbling notes and something like this is just an example, but someone said, they started virtual nursing for discharge and did not engage with case management as much as they should have
Oops.
right up front.
Yeah.
So everybody else in the room, oh yeah, I got to make sure that I do that,
Yeah.
so that we're not stepping on each other's toes, doubling up the work, just pulling them into it rather than, so that's
Yeah.
just one example of that kind of governance and then sustainment as well. So it's not like just great change management to kick off and then you're on to the next initiative. It's like, what's
Right.
the plan for checking back and how regularly. And then before we get too tired of this one slide, it's really meaty though, is kind of metrics to outcomes. So what are those initial metrics that are leading to the outcomes that take 6, 9 months to get to? And I don't know if you have examples. I know I do, Claire, on that kind of that final jump from metrics to outcomes.
Yeah, I mean, the one thing I want to say about metrics to outcomes is the importance of patience around those, and
Yes.
not patience, the people we're taking care of, but the one of the
Yeah.
fruits of the spirit, patience. Yes, because you have to be patient with the results because they're not going to happen overnight. Because under all of that implementation, you have adoption, you have that change management, you have that um, this doesn't work, I'm just giving up at this point type attitude where let's just persevere and keep at this because we know that this is a good solution. So I think that's something to think about, so that you don't lose motivation to continue.
Exactly, because like patient experience and readmission rates ultimately lead to good financial outcomes, but it's pretty lagging to get there. And so, for an example, I've heard several virtual nursing implementations talk about the very importance of the virtual nurses keeping track of the good catches as they're discharging patients. So, especially
Hmm.
patients with those key readmission diagnoses,
Hmm.
like the CHF, the COPD, like this, I caught this serious problem before this patient was discharged. And then I saw a CNIO talking about just pages and pages of these that the virtual nurses caught before the patient was discharged. So you could make the case to your leaders as we continue to do this, it's inevitable that our readmissions will be positively impacted as we get to that length of time that it takes to measure
Hmm.
that.
Yeah.
A bedside nurse, one health organization did a time study, of their traditional baseline process of discharging, and they watched a bedside nurse get interrupted 17 times during one discharge.
Wow.
So you just cannot do a quality discharge like that, and you're not going to have the kind of great,
No.
impact on readmissions. But
No.
it just takes patience.
Yeah.
Fruit of the
That's
spirit.
a powerful observation.
Yeah, yeah. Um, so and that, I actually that any other thoughts that actually that um, discharge conversation kind of brings us nicely to this next slide.
Yeah. Yeah.
So we asked, and when I got the results of this last survey, I wanted to I wanted to juxtapose these two questions that were asked separately. The first one was, which clinical and patient use cases has your organization implemented? And then which metrics are you using to measure success? And we kind of color coded these, but there is some really good, I think, some really good cohesiveness here.
Hmm.
That especially virtual sitting is the thing that most have already implemented, and patient safety was by far the top metric that was being measured, and that
Hmm.
makes total sense. And then discharge and admission, kind of close to close. I see like a 5-to-1 difference. Admissions are done virtually 5 times more frequently than discharges are done. And there are a lot of theories around that, but I think part of it is that the bedside nurse is more willing to give up the admission to a virtual nurse than they're willing to let go of that discharge, which is a little more critical thinking and kind of like they have ownership on that, and it takes
Hmm.
the expertise maybe of that particular care unit. I would love anybody to put in the chat why they think that in the actual data, and this is organization after organization, virtually admissions are done more often than discharges, even though discharge is supposed to be, and discharge really has a more immediate impact on throughput and patient flow. Um, and then we see, patient education, admission, discharge to me kind of go together and sort of lead
Hmm.
to some of these, dark green outcomes that we see on the right hand side. Um, the high acuity monitoring and patient outcomes, the more like quality patient outcomes, that where I see a lot, even just rapid response virtual nurses or virtual nurses in the ICU responding to sepsis alerts and just getting ahead of that for patients across the health system. But I was like slightly sad to see the low response on mentorship and mentoring as an outcome. So, what are your thoughts on any of it, or even particularly the nurse mentorship piece?
Well, I think one of the reasons you may be seeing nurses are more attracted to the discharge piece and allowing virtual nurses to do admissions versus discharges. They've spent several shifts creating that relationship with the patient,
Yeah,
and they
yeah,
want to see that relationship through. Not
yeah,
just the patient, but the family. They want to make
yeah,
sure that patient's got the resources they need upon discharge. So that could possibly be it.
yeah.
Um, so that may be one explanation, but it'd be interesting to see what other people say. I think
Mhm.
around nurse mentorship, I think all of us really, really want our nurses to have these mentors and to have a go-to person. But in some instances, it's just almost it's a burden to our nurses who serve as mentors because we are so short-staffed in so many areas that there's only so many mentors to go around,
Mhm.
and they're onboarding new nurses. They're dealing with larger assignments, and there's just not and I hate to use the word, but the luxury of mentoring other nurses, and that could possibly be it. But I think as we see more adoption of virtual nursing, that could change.
Yeah, and it is probably harder to measure too. I mean, ultimately, you would hope you get to lower turnover of new grads, but what are those KPIs that you even measure? How does a nurse check it, the virtual nurse check a checkbox that yes, I did 5 mentorings today, or have a
Yeah,
goal,
yeah,
so it is a little not as tangible. I had a great example of mentorship that just occurs incidentally, I think, with this really good model, if the virtual nurses are hired and the right type of virtual nurse is hired. There was during it was this actually happened during COVID, where a new nurse had an assignment that was incredibly difficult and demanding with complex patients, barely made it through the shift, And the virtual nurse, which is more of a kind of that high acuity monitoring, was really helping with labs, making phone calls, answering all kinds of questions. What's our latest policy on this COVID and that COVID? And finally, at the end of the 12-hour shift, that novice nurse called the virtual nurse and she said, I have one more question I have to ask you. And I've been bothering you all day, but am I doing a good job? You
Oh,
know, and I know. And so, of course, that virtual nurse was able to do some very, very important mentoring. And there just aren't enough nurses that I think have bedside med surge nursing as their career goal. And so I really, what can we do to increase that?
we call
And
it making med surge nursing sexy again.
yes, yes. Okay, Claire, let's do it.
Let's do it. Was it ever sexy in the first place?
Was fun. I did it
Yeah.
on the night shift, and I learned a lot.
Yeah.
And speaking of med surge, on the next slide, we were kind of asked about settings. And where is virtual care expanding beyond med surge? As far as virtual sitting, we see that really a lot in med surge, as well as that first kind of put your toe into virtual nursing where they're doing admission and discharges. So here are some of the areas where some growth is happening and some areas where no growth seems to be happening. Behavioral health is something I'm seeing a lot more of, and behavioral health patients can be everywhere, and that's like a very good virtual sitting use case for staff and patient safety, whether that behavioral health patient is in the emergency department or med surge. But we're also seeing a lot more in locked behavioral health units where patients have a dual medical and behavioral health diagnosis, and they might need equipment that could be potentially dangerous for self-harm, or queue, 5 times a shift virtual checks to keep them safe. So I'm seeing a lot of growth there. Are you seeing any buzz in any particular area of growth of virtual care, or anybody can put other areas in the chat that you're seeing as well?
I think we're seeing more in the emergency departments to help reduce some of the boarding
Yeah,
issues. So I
yes.
think we're seeing more there. Med surge was the best training ground for all of this. But I do think you're seeing a lot more in the emergency department.
Yeah. Um, I want before we move on to the next slide, I want to redo that poll. So we've kind of talked through where how respondents have rated themselves in the virtual nursing journey and all the aspects of it. So try to forget how you answered before and answer now, having looked at these, survey results with a good 90% confidence interval, a 95% confidence level on these survey results, where what did we hear, 29% consistently are saying like we're not doing any we're just pretty stuck on virtual care right now. So if there are a couple more people who will just click on their answers. Okay, good. Got a few more people answering. We may have not. I don't know. Can you see, Claire, the results yet? Or I don't know if the
Yeah,
audience sees. Okay.
yeah,
Okay. It still looks like it's kind of
about the same.
3-1, about the same. I was kind of hoping to encourage people, like maybe you're not lagging behind. Maybe you're right on track, or maybe you're even ahead of where you thought you were. Because I think that was my takeaway,
Yeah.
that people are still learning and still developing. And then the last couple of things we wanted to share, one is on the IT leader. So we mentioned on the second survey we added a lot more IT respondents, and we kind of separated out their answers. And priority wise, they see virtual nursing as much, very close. I don't know if 6.2 to 5.97 is really
Close.
statistically different, or yeah, I don't know if that, very, very close, seeing it as a high priority. But what I kind of love seeing is that the IT side of the house really, their top reasons are supporting the staff. Did you notice that too, Claire?
Yeah, yeah. And, I think that that goes to the notion of patient second. There's a
Mhm.
book about that, and we've talked about it being pretty controversial that patient should always be first. But it's sort of like putting your oxygen mask on first as a caregiver. You have to make sure that you are doing your job well, that you are there because you want to take care of patients, that we take care of our staff, because if we take care of our staff, if our staff have joy in their work, if our staff are focused on their work, then that patient safety is going to happen, and that patient experience is going to be a good patient experience. Our big focus these days is looking at the workload burden that
Mhm.
the staff have, because that's what's driving people away. Is there is just so much to do, and how can we reduce the workload?
Quick, go to the
Everybody's.
next slide. While you're still on that same um, thread, this next slide validates this, what you're
Yeah,
talking
yeah,
about there.
for sure. So I'm pretty heartened that our IT colleagues actually thought of the caregivers
Me too. Mhm.
as being really important.
And so does our Surgeon General.
Yeah, yeah.
So this is a really great, I recommend reviewing this advisory from the Surgeon General. So Vivek Murthy is our Surgeon General right now, and you might recognize that name because he wrote the bestseller, The Epidemic of Loneliness. So I think that the Surgeon General is really tapped into well-being and mental health, and so pulled together also this addressing health worker burnout Surgeon General advisory. And one of the top recommendations was to implement strategies and approaches to reduce administrative burdens so health workers can spend more time painting fingernails. Well,
Mhm.
we know what that means if you've been on, and instead of nurses spending 41% of their shift, behind a screen documenting.
Right. And I mean, I love that this was recognized by someone and it didn't come from the field. It wasn't us whining about burnout. It was,
Exactly.
this is
Yeah.
validation of what we've been saying for a long time, is that healthcare workers are burned out. Nurses, nursing assistants, techs, physicians, NPs, everybody. And we have to look at what burns us out the most, and those administrative burdens are
Mhm.
top of list. We went into this because we knew we were going to take care of sick people. We're not
Mhm.
we're not burned out because of sick people. We're burned out because of how we have to take care of sick people. Period.
Mhm.
And we may be
Yep.
burned out because of the way sometimes these sick people act in terms to
Yeah.
workplace violence and their families. But
Yeah.
it is, I mean, if we reduce some of the pressure on those administrative burdens, that is going to have a significant impact on burnout and the reduction thereof.
Yeah. Preach it. So yeah, I'm
Yeah.
glad to do anything to support that. And when I think we were talking about the adoption model, we talked about identifying the problem, deciding which workflows would address it, the change management, the governance, the sustainment plan. What are you measuring as leading KPIs and your lagging outcomes? And then at the very end, is technology. So it's not leading with technology, it's kind of making that decision almost last. Like what we know, how we want to solve the problem is we know what the problem is, and then going out and looking for the right technology solution. So, and I think we have some time. We'll take a little bit of time for a few questions while we're teeing those up. Just know that we will email you links to the copy of these surveys so you can help use them if you're making a business case. I'd love to just very grateful to AONL and Jocelyn and Chime to help us do those really rigorous market research, and we want to put it out in the public domain for anybody to use to help them. So I think we have that in a link in the chat. And then what other resources are there? What other resources can people leverage through AONL now, and what's coming, Claire?
So I can tell you that through our workforce committee, we have created a compendium, and within the compendium, we have some best practices, and those are separated out by domain. And within each domain, there is something, some project or some exemplar of virtual nursing that people are working on, whether it be a care model change or something like that. And those that have submitted exemplars have been generous enough to give their names and their numbers and said, please contact me. I can tell you about this. Now we're working on our next iteration of this compendium to where we're going to do exactly what I talked about. We want to hear from those people who have presented the exemplars, what their outcomes are, even if they're not great. And this is where the transparency piece comes in. Tell us if you failed on this, and this is something that you don't suggest people do, or you don't suggest people do some of the things that you did to try and implement this. So that's what the second iteration of the compendium is, and we've launched that already back in November. We're doing interviews of those folks that have done those exemplars. We also have, we're looking at creating virtual nursing guidelines in line with those that are already out there so that they become part of the AONL leadership competencies.
Awesome.
Because that's something that since the last time we updated the competencies, we didn't have virtual nursing, as part of those, and that those are going to be coming in on those particular competencies. And we have Nan Finnis is leading a group of folks to talk about exactly what we talked about today. What are some of the things that you're trying that have helped change your model of care, that have contributed to reducing workload for nurses that are taking care of the patients?
Okay, I think are you talking about the Leadership, Innovation, Technology, and Transformation Committee?
Yes, the LIT committee. Yes.
LIT. It's
yes.
LIT.
LITT.
I am on that committee as well.
Yes.
So that's awesome. And then of course we are sharing those survey results, and feel free to reach out to us too if you want to do a deeper dive on the maturity model framework and see if, kind of ask the questions and roll up your sleeves and kind of look at what you're doing and how the maturity model framework might help you. We're happy to do that. So I think let's just finish with this last question. What advice do you have for those who are not started yet on their virtual care journey?
Yeah, so from my perspective, having been a novice in this before and been kind of scared to say, how are we going to pull the trigger on this? Just first thing you have to do is identify what the problem is. And, you could do that from your employee engagement surveys. You can do that from your quality data. You can do that from your unit-based councils. And talking to those unit-based councils, what's going on that's just not working for you. And I know you're going to get from everybody, our electronic medical record is just too clunky, or I don't know that I've talked to anybody who thinks it's nirvana, but they've learned to adapt to it. But beyond the electronic medical record, what is it that you can think of that would be very that's the problem that you want to solve. So I think starting there is a great place to start. Get that voice of the nurse. Get the voice of the nurse who is delivering care at the point of care, whether it's the inpatient area, ambulatory, home care, across the continuum. Um, Virtual nursing is not only relegated to the four walls of the hospital. Virtual nursing can occur across the continuum and really make a difference for our caregivers and patients across the continuum.
Awesome. Those are great words to end by. I think engaging frontline nurses for sure, and then find your IT buddy, and find your
Yes,
finance buddy, and brainstorm and plan together rather than kind of like doing the whole process and throwing it over the wall and then having them have to sort of start over. So
right.
um, yeah, thank you so much for taking time out of your day, especially as you start this new really key role, Claire. It's a
Sure.
pleasure to talk to you again,
You too.
and look forward to the next time we see each other. And thank you all for those who have attended.